At ACC 2014, Janssen Research and Development announced it was adding 3 new clinical trials to its Explore Global Cardiovascular Research Program for Rivaroxaban. Now we're at ESC, we're in Barcelona, and Janssen and its development partner, Bayer Healthcare, have announced a further expansion of the Explore Global Research Program, and it's really exciting because there's a lot going on. And so I'm talking to Dr. Anne Hermanowski-Vosatka, MD, PhD, Vice President, Compound Development Team Leader for Xarelto at Janssen. Okay, Rivaroxaban has gotten a bunch of trials going at the present time, and this global program is phenomenal. Can you describe the program first before we get into some of the specifics?
Sure. Let me just first start by saying that we know that Rivaroxaban is a proven anticoagulant. We have multiple studies that have already demonstrated that, but we are very conscious that there are many diseases where blood clots underlie the pathophysiology, and we are deeply committed to addressing as many of those unmet needs as possible. And so we are undertaking an extensive life cycle management program with the most indication-seeking trials of any of the anticoagulants in collaboration with our important development partner Bayer to look at as many of these unmet needs as we possibly can in order to explore how we might help patients and make a difference in their lives with this molecule.
Now we're talking about some 275,000 plus patients enrolled in these.
That's right.
You had 3, that was the announcement at ACC, now we're a few months later at ESC. So how many trials are we talking?
Right, so altogether, since March of 2013, the total number of trials that we've announced in the life cycle program Explorer is 11. Wow. There are 3 new ones that we're announcing this time to make it a total of 11, and a total of 6 ongoing indication-seeking trials. The 3 new ones will be efforts to understand the effect of Rivaroxaban on preventing events in acute coronary syndrome patients, importantly in a regimen where there's Rivaroxaban on top of a single antiplatelet agent. There's an effort to understand how Rivaroxaban could make a difference in prevention of a recurrent embolic stroke of undetermined source. And finally, there's an effort to understand how in patients with peripheral arterial disease who have recently had an intervention in their limbs, how we might prevent a recurrent event in their limbs or a major coronary event. Those are the 3 new ones. The previous ones include studies such as Mariner, which we announced in March of this year, which is an effort to understand how Rivaroxaban can make a difference in patients who have a medical illness that puts them at higher risk for blood clot. Commander, an effort to look at Rivaroxaban in the ability to prevent coronary events in patients who have heart failure as well as coronary disease. And Compass, which is an effort to look at secondary prevention of coronary events in patients who have coronary disease or peripheral arterial disease.
Now, at this meeting at ESC in Barcelona, you've got data being presented on the X-VeRT trial in the setting of cardioversion.
That's right.
And now we have some data available. How did this trial go?
Well, so we were able to examine the effect of Rivaroxaban on prevention of major coronary events in the setting of an atrial fibrillation patient undergoing cardioversion. And we compared that to what's now standard of care, which is warfarin, and we're looking to see whether or not we were similar or could in fact have reduced numbers of events. It's a small trial, and numerically we did see fewer efficacy events as well as fewer bleeding events. But of course, we did not have enough of a size trial to get statistical significance.
But it's exciting, we're starting to get some data out.
Absolutely, and I think the important thing for patients is, unlike warfarin, which requires extensive blood monitoring in the few weeks that lead up to their cardioversion procedure, here with Rivaroxaban that won't be necessary.
Now with all the excitement, we have to ask you the one question, when are we going to start seeing some more data? I mean, here we are at ESC, so we got a little, maybe anything by AHA or RACC meeting in the spring?
We have some things up our sleeves, but right now I couldn't say exactly when we'll be ready to share them with you, but we certainly will be looking forward to doing so.
So in the months ahead, we should be able to see some of the data. I mean, we're not talking years out in many cases. There should be something soon.
There's a lot going on, as you heard, with so many trials. I imagine we'll have lots to tell you.
Congratulations. I mean, I think it's a phenomenal effort across the globe.
Thank you.
And I think we're going to find some very interesting uses here for Rivaroxaban.
Well, we're all very excited to be part of the Explorer program and to see how we can make a difference in the lives of patients.
We have a lot of things that we're talking about here at ESC. This is just one of them. For more information, please go to the cover story for CardioSource World News. I'm Executive Editor Rick McGuire.